Each year, about 23 million Americans visit a doctor's office or clinic seeking treatment for infections. Unlike many disorders, we know the exact source of infectious diseases, and in many cases, we have vaccines and treatments to fight them. One area of particular concern is antimicrobial resistance, a potentially deadly situation in which bacteria become resistant to most of all antibiotic drugs. We recognize this urgent threat, and our scientists are working to better understand how microbes develop resistance to antibiotics, finding new diagnostics that can more quickly detect resistance, and finding new antibiotics, drugs, and vaccines to prevent and treat bacterial infections. But because no one knows when a new or re-emerging infection diseases will arrive and how dangerous it may become, NIH must remain vigilant and prepared with prevention strategies such as ability to launch rapid vaccine production. Readiness for such unwelcome health surprises also involves ongoing basic research on microorganisms and the human immune system. The Ebola virus, which ravaged West Indies in 2013, killed more than 10,000 people and severely strained regional socio-economic stability. When this crisis hit the world, NIH, home to the nation's largest medical research hospital, jumped into action as one of 4 designated US research hospitals to care for infected healthcare workers. NIH scientists worked to rapidly test a promising prevention vaccine, experimental Ebola treatment. In this video, we are going to discuss about top 10 ways to prevent infectious diseases. So let's go to the video. Top 10 ways to prevent infection. Number 1. Wash your hands frequently. Did you know that microbes can live on inert surfaces anywhere from a few minutes to several months? Imagine these disease-causing microorganisms living on your computer keyboard, your light switch, or even on the elevator button. Surprisingly, most people don't know the best way to effectively wash their hands. The Centers for Disease Control and Prevention (CDC) recommends washing thoroughly and vigorously with soap and water for at least 20 seconds, followed by hand drying with a paper towel. Number 2. Don't share personal items. Toothbrushes, towels, razors, and nail clippers can all be sources of infectious agents, bacteria, viruses, and fungi. In kindergarten, you were taught to share your toys but keep your hands to yourself. Now try to remember to keep personal items to yourself as well. Remind children often about the types of items they should not share with others. Number 3. Cover your mouth when you cough or sneeze. In a similar vein, good personal hygiene includes not only personal cleanliness, but also the age-old practice of covering your mouth when you cough or sneeze. Why is this important if you aren't sick? For most infections, the disease-causing microbe has already started growing and diving long before any symptoms begin to show. Coughing or sneezing can spread these germs through microscopic droplets in the air. The current recommendation is to cover your mouth with your arm, sleeve, or crook of the elbow rather than using your hands. Number 4. Get vaccinated. Your immune system is designed to have a memory of previous infections. When your body encounters a microbe that has previously caused an infection, it enhances its production of white blood cells and antibodies to prevent infection a second time. However, by getting vaccinated, you trick your body into thinking that it has been infected by a particular microbe hence enhancing its own defenses against subsequent infection. Of course, consult your clinical about receiving vaccinations, especially the annual influenza vaccination. Number 5. Use safe cooking practices. Foodborne illnesses frequently arise from poor food preparation and dining habits. Microbes thrive on virtually all food items and more so on foods left at room temperature. Refrigeration slows or stops the growth of most microbes. Promptly refrigerate foods within 2 hours of preparation. Use separate cutting boards for raw meats and vegetables. Keep clean countertops and wash all fruits and vegetables well prior to eating. Number 6. Be a smart traveler. Infectious diseases can easily be picked up while traveling, particularly when traveling to undeveloped countries. If your travel destination is one where water is questionable, make sure to use a safe water source such as bottled water for drinking and brushing your teeth. Eat foods that have been cooked and avoid raw vegetables and fruits. Finally, be sure to update all immunizations that are advised or required for your travel destination. Number 7. Practice safe sex. Sexually transmitted diseases are probably the most easily preventable infectious disease. By being smart about safe sex, using condoms, transfer of infectious bacteria or viruses from one person to another can be prevented. Number 8. Don't pick your nose or your mouth or eyes either. Not only is it a social taboo, but it also leads to the spread of a number of infections. Look around and you will notice how many people have their hands next to their faces. Many microbes prefer the warm, moist environment inside your nose, as well as other mucus covered surfaces such as eyes and mouth. Infections can be easily prevented by avoiding touching of these areas. Number 9. Exercise caution with animals. Infections that can spread from animals to people are called zoonotic diseases and are more common than most people realize. If you have pets, make sure they get regular checkups and that their vaccinations are up to date. Clean litter boxes frequently. Unless you are pregnant, stay away. And keep small children away from animal feces. Number 10. Watch the news. A good understanding of current events can help you to make wise decisions about traveling or other recreational activities. For example, a bird flu outbreak in Asia may make you think twice about a trip you were planning. Recent reports of West Nile virus spread by mosquitoes. You may want to bring some insect repellent on your camping trip after all. Salmonella in tomatoes. Don't eat tomatoes. Listeria in cantaloupes. Don't eat cantaloupe. You get the idea. In this video, we discuss about infectious diseases and top 10 ways to prevent them. If you got this video helpful, please give a thumbs up to the video. Don't forget to share this with your friends. Subscribe the channel for more important videos like this. Thanks for watching.